Hello, thank you for joining our webinar on opioid awareness and prevention. My name is Anali Ramos, and this is my partner.
Hi guys, I'm Ali.
And we're both Masters of Public Health students doing our practicum at the Campus Health Center. We hope that you gain knowledge on opioids and are able to use this information and share it with anyone that needs it. The objectives for our webinar is to bring awareness on opioids and opiates, the waves of opioid overdose, prescription opioids, signs of dependence and addiction, treatment and prevention options, and any available resources individuals can seek. So knowing the difference, before anything, we have to know the difference between opioids and opiates. These two terms are used interchangeably, but this is not always correct to do so. Opioids is a term that was created to place natural opioids, semi-synthetic opioids, and synthetic opioids together. Semi-synthetic opioids are from natural opioids and synthetic opioids are made in the lab. Opioids tend to be more addictive and are more likely to be abused. Opioids are sometimes known as narcotics, which basically means that they are much stronger than your average over-the-counter painkiller like Tylenol, Advil, or Aleve. And opiates come from the opium poppy plant. Some examples of opioids and opiates. All natural opiates such as heroin, codeine, morphine, and opium, they're all examples of opiates. Natural opiates are derived from the poppy plant, which tends to be smuggled in from across the world, and the United States does not grow it. Semi-synthetic opioids, which are oxycodone, known as Oxycontin, hydrocodone, known as Vicodin and Narco, and hydromorphine, which is known as Dilaudid. And synthetic opioids, which are methadone and fentanyl. There are three waves of opioid overdose. The first wave started in the 1990s and continued to steadily increase. So this is when prescribing opioid medication began to increase and the overdose deaths began to increase as well. The second wave began in 2010. There was a dramatic increase on overdose deaths involving illicit drugs like heroin. And finally, the third wave began in 2013, and it is still happening today. This is when an increase in overdose deaths that involve synthetic opioids, especially those related to illegally manufactured fentanyl. Illegally manufactured fentanyl changes over time. It can be in heroin, counterfeit pills, and cocaine. And then the CDC website gives us this picture, and it's a good representation of the waves that have happened in the past and that are currently happening today. Prescribed opioids are usually for patients that have moderate to severe pain. Opioid medications block pain signals from the brain to the body. Taking either prescription pain medication or illicit drugs can cause physical and psychological dependence. Both opioids and opiates can cause addiction. For example, oxycodone is an active ingredient in many medications that individuals abuse. For example, Percocets. Vicodin and Dilaudid are the most commonly abused prescription opioids out there. So how do opioids affect the brain? Opiates and opioids produce euphoric and tranquil effects in the brain when taking more amounts than prescribed. Drugs interfere with the way neurons send, receive, and process signals via neurotransmitters. So the pleasant feeling the person experiences is what leads to abuse. Most addictive substances cause the brain to release high levels of chemicals that are associated with natural pleasure or reward. Over time, these chemicals cause changes in the brain systems that are involved in reward, motivation, and even memory. Using prescription opioids, prescribed opioids can increase your tolerance and dependence. And then addiction leads to side effects such as destruction of the brain cells. Addiction is a disease. It is clinically referred to as a substance use disorder. Addiction disrupts regions of the brain that are responsible for judgment, learning, and memory, as I mentioned before. It is a complex disease of the brain and body that involves compulsive use of one or more substances. Addiction is a treatable disease with the right professional help, and the right access to these treatments can help that individual. So more than 11.5 million people reported misuse of prescription pain medicine in 2016. And this was ages 12 years and older. And then medical providers are worried that their patients may be addicted or may become addicted. They reported that they lack training in prescribing opioids. So how did the guidelines for prescribed opioids begin? It began with pharmaceutical companies reassuring medical providers that prescribed opioids were not addictive. This was so providers could start prescribing more opioids, and they did. Then there was a misuse of the painkillers, and patients became addicted, and the overdose rates increased. Once providers stopped prescribing opioid painkillers, the new alternative was heroin. Opioids to heroin. Roughly 3 out of 4 heroin users that recently began to use reported that they abused opioid medication in the past. It is easier to get a hold of heroin than prescribed opioids. For one, there's no prescription needed for heroin. Two, street prices are more affordable for heroin than it is for prescription opioids. Heroin can be injected, smoked, or snorted. It is quickly absorbed by the brain, and it produces a maximum effect that is extremely dangerous and highly, highly addictive. Very high risk of overdose and deaths among users. From heroin to fentanyl. Fentanyl is known as heroin's synthetic cousin. Sadly, new types of drugs are being made and are being misused. Dealers are adding fentanyl to improve the drug user's high. Drug users usually don't know when heroin is laced with fentanyl. They can take a deadly dose without knowing it. Heroin and fentanyl look similar. As the picture on the right was from New Hampshire State Police forensic lab. The left tube is about 30 milligrams of heroin, and the right tube is 3 milligrams of fentanyl, which is enough to kill a male adult. Here are some signs of opioid dependence to look out for. So it's decreased performance at work, home, school, etc. Not interested in their favorite activities anymore, always feeling tired, drastic change in social network, eating or sleeping habits are changing, and there's a decline in relationships with family and friends. Some statistics involving opioid deaths in Michigan versus the nation. In Michigan, in 2018, 78% of overdose deaths was due to at least one opioid, a total of 2,011 deaths. 633 of the opioid-involved deaths were due to heroin, and 556 deaths were due to prescription opioids. And medical providers wrote about 62 prescriptions for opioid medications for every 100 individuals. In the United States, out of 70,630 drug overdose deaths in 2019, 49,860 were due to opioids, which is 70% of the population in the United States. From all 50 states, none showed a significant decrease of overdose deaths from 2018 to 2019. I will pass on the next slides to my partner, Ali, who will be discussing signs and symptoms of overdose, treatment and prevention options, and any available resources for anyone to seek. Thank you.
Hi guys, this is Ali again, and thank you, Ali, for your presentation. So Addiction starts with making a choice, which is using the drug. What happens is after you start using the drug, something called dependence starts. So with dependence, you're using a certain amount of the opioids repeatedly, and after a while, even though you're using the same amount that you used a while ago, you feel that it is not producing the same pleasant feeling that Anali mentioned anymore. And now you decide to take more and more when it comes to the quantity of that drug that you're using. And at that point, this is a controlled action because you made the decision, and that could lead to addiction when that action is no longer controllable, it's no longer your choice. Now your body is actually taking over and is telling you need more and more, and that leads to addiction, and finally, and unfortunately, death. Next slide. So let's talk about the signs of symptoms that you may witness out there for overdosing, and we're going to tell you a little bit later how you can do your own part as a part of this society who could help addicts. So the things that you may see out there among addicts is the falling asleep becomes more and more. So they take more time to sleep and they sleep more repeatedly, and they become more and more unconscious. And we know that the fact you sleep for so long, for several days, medically, you could be pronounced as a person who is in coma, and very long time comas could possibly lead to death. Unfortunately, that will be the case. Next slide. So hopefully before we get to that point where we see somebody who's overdosing and dying, what are the symptoms that we can witness that are out there for us to see so we can make some difference? We would see that the other person has a pale face, clammy skin. They might be vomiting, and if you physically check their pulse, which is usually here in the wrist area, you will see there's a slower pulse going on. Next slide. So what can you do at that point when you think that person is overdosing? Now, before I introduce to you this product, which is a great product, by the way, the first thing you do if you see somebody who's overdosing is you call 911, you report what are you witnessing. If you are qualified and you know how to apply or administer CPR, you do so. At this point, after you apply CPR and you believe that the CPR is not doing a good job, that is when you apply this product. It's called Naloxone. So, or as many of us know, it's called Narcan. So Naloxone is a very simple product. And we'll show you in the next slide how do we actually use it. So this product is usually sold as one time, one use. So you will tear the package. The package is basically made of a nozzle on a plunger. You are going to administer the nozzle into the nostrils. You are going to use the plunger. You're going to press on the plunger all the way, make sure all the product is gone through the nostrils, and immediately, or at least very quickly, that product will have its positive effects of reducing and hopefully saving that person's life who is experiencing an overdose. Now, soon after you apply the Narcan, it is very important for you to put that person into a recovery position on their side in case they vomited. You don't want them to choke on their vomit. Next slide. So luckily in this country, we have something known as the Good Samaritan laws. And these are applicable in most of our states. So this law perfectly saves you as a witness. So let's say you witness somebody who's overdosing and you chose to help them, by using the product that I just mentioned. If you were wrong in your simple off the bat diagnosis and that person was actually not experiencing an overdose, and you actually applied that product for no reason, well, the good thing is it doesn't have severe health effects. It's not going to send that person to the hospital. It is not going to kill them. And legally, you are safe from, being prosecuted at this point. Next slide. So so that's on a smaller scale than what you can do as a person. So if we look at the community base, what can we done? What can be done so we save the future generation and also the current ones from the malice of this wave, the third wave that we are still experiencing for about 8 years now. We have a combination of three items. The first one and the most important one is how we care for our kids and the next generation, and it all starts with the prevention. As you know, addiction takes time to happen. It may take months, years, or even decades. So it is very difficult for us to actually stop the problem right away. This is not like the famous and ongoing epidemic or actually pandemic of corona, where we simply make up a vaccine, we give it to people, and it saves millions of lives. We don't have vaccine for opioids. And even if we did, I don't know if it's legal to go, give a 15-year-old a shot telling them you're not going to be an addict in the future. So it's very complex. So the best thing is to actually prevent them and reduce their accessibility to opioids. Now, let's say prevention is for the future generations. What can we do for the current generation? We have a mixture of two types of treatments. We have the actual physical ones of products that we could administer to the addicts and help them overcome their problems, such as methadone. And also there is, outside the physical treatment, there is that psychological treatment. Is very behavioral. It's that positive energy that we could give and the support, such as one-on-one counseling or group counseling, which is very helpful, peer support, and also the 12-step fellowship program. Next slide. So let's talk more about prevention. What do we have out there that has been outlined by the CDC? First thing to mention is the policy evaluation. We need intervention. We need to evaluate the interventions that we currently have to better understand what works best to prevent drug overdosing. There's a project known as the RRP. It's the Rapid Response Project. It is where you implement a project to advance prevention approach and respond to new and emerging crises. And because currently we're living in a new one, a new epidemic is the third one, and God forbid we might have a fourth wave in the future. Hopefully not. Next slide. We have the prescribing drug monitoring program, and that actually came arise when the problem started back in the 90s, and it was actually overprescription. And now we learned that the problem started actually through the medical field, where some people somehow got a hold of so many opioids, and it was kind of difficult to track. So when they got too much opioids, at the point they started, unfortunately, their addiction, and that led to cases of death in our society. So now we have that program, so we can control, and we know, like doctors and pharmacists know, if you have been prescribed enough opioid in the past, so they know how much you need currently. Lastly, we have community health system interventions, and they provide technical assistance to high-burden communities and counties. We know some states are less fortunate than other states. When it comes to education and it comes to economy, it's we find that um, communities or states who have lesser education and smaller economies, they struggle the most. As far as I know, West Virginia has the highest prevalence of opioid addiction and overdosing in the entire nation. If you look at the economy of West Virginia, I believe it's one of the weakest. I think it's in the bottom five in the United States. Next slide. So what about, let's take it back on a smaller scale. What is Wayne State University doing in Michigan? So we have three things. The Center for Urban Studies has a program called Strategies, Tools for Overdose Prevention. It is very easy to find because the acronym is actually spelled as STOP. The second one is, which is what we are here for, the Campus Health Center, where me and Anali have been working with in the past few months. We have an initiative to increase opioid awareness among Wayne State students. Lastly, the Michigan Poison Center at Wayne State. We have experts in substance abuse and drug safety for people who are in need. Next slide. So let's take it on a very small scale here. Me and Anali, what have we been doing in the past few months? We are presenting a pre-recorded webinar, as you can see us, and it's gonna be on the Campus Health Center YouTube channel, which you can type it and find it. And this video will be out there for whomever needs to learn more about opioids and how can they make a difference in their society. We're also, recently we developed a questionnaire that aims to assess knowledge and attitudes of the Wayne State students regarding opioids. So it may sound that knowledge and attitude are the same thing, but they are slightly different. Because sometimes even though you have the proper knowledge about a certain thing, such as opioids, unfortunately, studies have shown if you actually misuse that drug, you are less likely going to have that positive attitude to make change into society, and that's why we want to increase the knowledge among the students and empower their attitude so it becomes positive and they make change in their local community. Next slide. So what about you? What can you do to help us? It is very simple. You can fill out a survey when it comes out, and it's going to come to you very soon. You can also pass out handouts that provide help, and it's very important for us to be part of that solution. And then you can pass out these handouts to your colleagues, friends, faculty members, your family, or even strangers. Next slide. So what have we learned today? A couple of basic things. Opioid addiction is a disease. It is a problem. It is prevalent in our society for about 30 years. The best treatment for opioid addiction, as I mentioned, is definitely prevention. And lastly, to reverse an opioid overdose, simply administer Naloxone. Next slide. So thanks everyone for joining us. If you have any questions, this is the phone number that you can contact, and this is the website. It is campushealth@wayne.edu. And before we finish, we want to mention somebody who is very special to us, me and Anali. A person who has guided us in the past 3 months, is a mentor. Her name is Erica Blaskey. And we have a Q&A session. We're going to ask her a couple of questions, very common ones that helps us and you guys learn more about opioid overdoses and how we can treat it or prevent it. But before we start the Q&A session, I would like Erica to present herself and tell us about herself.
Hi there, thank you for having me. My name is Erica Blaske, and I am the community outreach nurse at Campus Health Centers. You may have seen me around campus giving shots and stuff. So I'm here to kind of help answer some questions about opioid use and substance use.
Thank you, Erica. We appreciate your time being here with us. We'll try to be quick because we know you're very busy. So I have a couple of questions for you. The first one is, why is opioid misuse and addiction is common in our communities?
So according to American Addiction Centers, it was the efforts that were in place to address the opioid epidemic have kind of led to prescription opioids becoming less available. So people are having to turn to alternate routes to obtain these medications. People were then trying to, because maybe their doctors stopped prescribing them, they were returning to getting the medication off the streets, which is incredibly costly. So eventually they were turning to heroin, which has similar effects, but is also cheaper and easier to access. And as Anali mentioned, huge numbers of people who currently use heroin do have a history of prescription opioid misuse.
Very interesting and unfortunately sad news to hear, but it is a problem that we are facing in our society. My second and last question to you is, can prescribed medication somehow lead to opioid addiction?
Yes, it can. Prescribed opioids do help relieve pain, but they can also lead to feelings of relaxation and intense euphoria, especially when they're misused, like Anali mentioned earlier in the population, or in the presentation, sorry. In addition to blocking pain signals, opioids do release large amounts of dopamine, which is our reward neurotransmitter in our brain. And this release of dopamine is what causes the user to want to repeat the experience over and over. And then eventually the brain's natural reward system becomes altered, and it makes it difficult to stop using. And this is what creates that physical dependence, which makes it harder to quit using, because now also if the user quits using, they risk going into withdrawal, which is, for opioids, it's not necessarily a medical emergency, but it's incredibly unpleasant and can last for several days. So they continue taking the medication to avoid having those feelings of withdrawal.
Oh, I see. That makes more sense. My colleague Anali, who was with us earlier, she has also a couple of questions that she has for Erica.
Erica, my first question is, what increases the risk of overdose from prescribed medications?
That's a great question. There's actually several things that can be kind of pre-indicators that somebody may be at higher risk of becoming addicted or overdosing. You have a lot higher risk of overdosing if you take multiple types of narcotics at once. So if you take the opioids, such as like Oxycontin, and then you add it on to like a benzo medication like Xanax or Ativan, those compound effects can definitely lead to a higher risk of overdose. If you get your medication or your drug from a non-professional source, it does increase the risk of having that medication being cut with stronger meds like fentanyl. So always making sure that you're getting your medication from a reliable source like your doctor or a pharmacy. Drinking alcohol while taking narcotic medications can increase your risk of overdose as well. If you are trying to self-medicate without the guidance of a physician by taking prescription medications because you think that maybe they're just a low dose and they shouldn't have too many harmful effects, that can definitely be a high risk factor for overdosing because you don't know exactly what dose is right for you. Recent release from prison or an abstinence-only treatment center, that can also be a high risk of somebody overdosing because they go to jail or they go to this abstinence-only treatment center and they are no longer considered addicted anymore because they haven't had access to their medication. and then they get out and they think that they can take the same dose as they were before, and then they accidentally overdose themselves. So that's another one. People who have underlying cardiac or lung issues like sleep apnea or heart arrhythmias, that can put you at higher risk. If you have history of bipolar disorder or schizophrenia. And then finally, which is also another very sad one, is patients who are within the chronic pain population are already at elevated risk for suicidal ideation and suicide attempts. So having to deal with chronic pain in your life can already put you at high risk of not accidental overdose, but also intentional overdose. So that's just another factor to be aware of as well.
Thank you for that. My next question is, how can opioid misuse be prevented?
So the best way to avoid being addicted to opioids is to avoid taking them in the first place. But if you are prescribed the medication, understand that you need to take them only as they are prescribed, and understand that this is usually not meant to be a long-term solution to your pain. It can help get you through maybe the first couple of days after a surgery, for example, but then you should talk to your doctor about other options for managing chronic pain, such as physical therapy, meditation, stress reduction, all of those different kind of non-medication therapies are proving to be very effective at helping people manage their chronic pain. So just understand that opioids are not meant to be an end-all be-all for managing chronic pain, and that there are other techniques out there, and to talk to your doctor about more information about that.
And then I have a last question that may be important to some of the students or anybody listening to this webinar. What should you do if you suspect a loved one is addicted to opioids?
That's an excellent question. I think the best thing that you can do is arm yourself with knowledge. Number one, always know how to recognize the signs and symptoms of an overdose, like how Ali mentioned, cold, clammy skin, pinpoint pupils, signs that someone's having difficulty breathing, like agonizing breaths or loud breaths and irregular breaths. And if you have a high suspicion that you have a loved one that is addicted, you can get Narcan to keep with you. In 2016, Michigan actually passed a standing order law, which means you can get Narcan from a pharmacy without a prescription from a doctor. You can get a prescription from a doctor, but as an alternative, you can obtain Narcan from a pharmacy for use in an emergency without an individual prescription. So I think the last piece of this is to just be really supportive and non-judgmental toward the patient. Let them know that you're there for them. Have different resources at your disposal. So in case they ask, you can offer them evidence-based, effective treatment options. One good resource that I like is the Substance Abuse and Mental Health Services Administration helpline at 1-800-662-HELP. There's a website called findtreatment.gov, which can help you find addiction centers in your area. And then if you're more of a 12-step program kind of person, there is also the option for Narcotics Anonymous. And if you have immediate concerns and you're not really sure where to turn, Campus Health Center does have a social worker on staff who is experienced with substance use concerns. You can always give us a call for resources. Then there's also CAPS at Wayne State, which provides free counseling and psych services to the Wayne State student population. And there's their number there, the 313-577-3398.
Thank you so much for the information and for taking the time to answer these questions. And
Sure.
we would like to finish off with our webinar. If you have any questions, like Erica said, please feel free to message the Campus Health Center. This is their email, campushealth@wayne.edu. And this is their phone number. If you have any questions, highly recommend you reach out to them. And thank you so much for watching our webinar.
Thank you guys,
Thank
and thank
you.
you, Erica. Appreciate your time.
Thank you.